My name is Jennifer Quayle, and I'm from Brant, South Dakota, and I work at South Dakota State University in the Facilities and Services Department as an interior designer and facilities and space planner. I've always been a firm believer in preventative care, right? Routine annual exams, the mammograms, the pap smears, those sorts of things, and so this was just another one of those routine preventative care that I do. So my experience with scheduling was my primary care said that the hospital would reach out to set everything up, and they gave me a call and went through some dates and things to see what would work, and we got a date settled, and then kind of talked about what the procedure was going to be, and also said that they would send me some information in the mail so that I didn't have to try to remember everything on the phone or write everything down. But it went really smooth, just like they said it would. So I received the information, which was a variety of different things, but very informative, right? The good stuff that was in there. I think there's kind of a bad rap on preparing for the colonoscopy, but I think that things have changed and evolved, and it's really not as bad as you think. Some of the stuff that was in there that I felt was really helpful was information on what to eat and what not to eat, and there's really a lot more of what you can eat than you think. And so I took that information and just kind of created my meal plans for the days that I needed to adjust my diet a little bit, and then went and got groceries and made sure that I had those things. So it really kind of put my mental state at a peace of mind for that. Like, this wasn't this big, scary, daunting, awful thing that was going to happen, that this is very manageable, this is very doable, this is still food I like, those sorts of things. So that went really smooth, and as I was working through that, I did have a question on some food items, and so they said to call, so I called, and they really did mean it. They really do want you to call and ask those questions, and so she answered my questions with the positive, because I think I was asking about chocolate. My impression of Dr. Marquin was really one of comfort. I had not met her until right before the procedure, and so that can kind of be a little challenging, awkward, those sorts of things. But she came in and she was just really kind and genuine. She asked questions, made sure I was comfortable about what we were going to do, and made sure I didn't have any other additional questions. And so I just really appreciated. She just seemed really personable and put my mind at ease. So I appreciated that. So the Brookings Health System team was amazing. From the time we walked in early in the morning, the person that greeted us was awake and positive and happy, and we got checked in, and just really short wait time before we got back to our room. The nursing staff that was there was great. She was, again, really comforting, thorough. I felt very at ease with her abilities. She made sure I knew what was happening next and why, and then who else would be coming into the room to talk with me. The anesthesiologist, Dr. Marquin, all of the different staff, and they all took time to make sure that I had my questions answered, that I felt comfortable. And I think another part that I really appreciated was it was a comfort level where we could small talk, and we small talked about things that really didn't have anything to do with the day, right? So I think it was the anesthesiologist asked about a distant cousin, and the nurse was a recent graduate at SDSU, and that's where I work. And so there were these things, these connections that we made, and you can only do that when you're at a certain comfort level and when people genuinely care about you. So that really stood out to me. I really appreciated those connections. You know, I felt just fine after the procedure. I had a history of being nauseous after having anesthetic, and so I mentioned that before the procedure and was assured I was going to feel fine, and I did. I felt great and fine, and I was hungry. And so, but I was able to eat right away, which was super fun. So, no, I felt great. No discomfort, no pain, no nausea. If you haven't had a colonoscopy and are nervous, I would say don't worry about it. It is seriously not that as bad as all the hype that they make it out to be. Very doable process, easy, simple, painless procedure, and just an overall good experience for that peace of mind for another decade. What I appreciated most about my care at Brookings Health System was I felt like I mattered. Everyone that I interacted with, from that pre-procedure phone call all the way to the post-procedure call, they really seemed to be taking time to listen to me and to any questions that I had. I never felt like anybody was rushed, that they were just checking a box, that they were just moving on to the next thing, right? They took time to really listen to me, to answer my questions, and I kind of felt like I was the only person they were taking care of that day, and I know I wasn't, but they made me feel that way, and to me that really matters. That makes a difference. I would recommend Brookings Health System to others in the community, for a few different reasons. The typical ones would be it's close, right? It's convenient. It's a great facility. There's been new renovation, addition, remodeling that's happened. We've got great technology equipment to provide optimal care here. But really, for me, those two things are irrelevant if we don't have the right people that are doing it. And I just had a really great experience with the care team from check-in to check out. That really makes a difference for me. They were all very genuine. They created a sense of comfort for me. I could relax. I could be at ease. I knew I was in good hands, and I knew that they really cared about my care.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.